kinds of decisions that face patients, what type of treatment, what's the toxicity of treatment, especially when you have newer options coming to the market. Not inpatient infusion versus oral versus. I mean, there's so many different types of decisions that face patients when they're trying to figure out what's the right therapy for me, or what's the right therapeutic approach for me. It would seem, again, for me, it sounds like a no-brainer that this kind of helps guide that conversation and should be a natural part of the discussion. And maybe it's just that it's just been informal and nobody's documented it and really utilized it as a way to systematically then make decisions or systematically support the use of a particular intervention. But it would seem like natural in oncology.
Yeah, it is interesting. I mean, I haven't seen this before. I mean, it's not like I'm an expert on every outcome measure out there, but this is the first time I've seen where people get excited about using an outcome measure in a clinical trial. Most people don't like gathering information on standardized endpoints. It's not fun, right? Just asking the patients all these things and going through all these lists. So with goal attainment scaling, as I said, it changes the dynamic and changes it's like a shared language between the patient and the clinician. And it's like a reward for the patient. You go through the whole day of being poked and prodded and asked this and surveyed that and assessed with this and assessed with that. And then someone sits down and says, right, what's actually important to you? And why is it important to you? And why do you want to achieve that? And let's think about this trial, your ability, how you might get there. And it's like a breath of fresh air. But then what happens after that is, I think, fairly, it can be quite a complicated thing to implement because it is a really nuanced conversation. It's a full interview. It takes time. It's not a 5-minute checkbox. It's a little more complicated than that. So some clinicians are worried, I think, about how it's going to go to implement this in the trial. And usually what we see at the end of the trial is they just want to keep using it in their clinics because it allows them to get to know their patients better. We have some good qualitative data in some of our work in hemophilia where the social workers were saying, wow, I've known this patient for X number of years, and I finally get him. I know what's important to him. I know the language he's trying to speak. When I'm talking to him about his prophylaxis regimen and whether he should infuse at this point in his day or that point in his day or how to gain independence, you can see his eyes glaze over. But if I talk to him about wanting to play soccer on Friday with his friends and not have a joint bleed, and then I start talking to him about his prophylaxis regimen, it's a game changer. So we're speaking the same language now. So I thought that was interesting. Like very few things before I've seen after the trial that people want to keep using, but they seem to like using goal attainment scaling once they get used to it.